My name is Drew Patiter. I'm a spine surgeon. I am trained both in orthopedics as well as in neurosurgery. I did my orthopedic training at Johns Hopkins Hospital, and I did my neurosurgery fellowship at the Cleveland Clinic. I've been in practice for the past 16 years. I specialized in minimally invasive surgery, in disc replacement, in robotics, and in scoliosis surgery involving um, the neck, the mid, and the low back. I also do regenerative medicine, which is an evolving field, but we're also staying abreast of that and kind of constantly updating our knowledge base as well as treatments associated with that. What spinal fusion is if you have some instability in the spine where the bones are malaligned, and that is typically associated with pinched nerves, it can cause pain in the back and or pain and numbness and tingling that goes into the legs. And what spinal fusion surgery is the first thing is you want to unpinch those nerves. So that's called a decompression or a laminectomy or a foraminotomy. And then, in addition to the decompression, you would also realign the spine of the bones of the spine so that in time they can mend and weld together. And that provides you stability, thus helping decrease or eliminating pain or numbness or tingling and other symptoms like that. So the most common one, of course, is spinal stenosis, and what that means is that due to uh, disc bulge or a bone spurs, if your nerve is pinched, then you can do a spinal fusion to stabilize it. Conversely, because you can also do a disc replacement, which allows you to keep some of the mobility there as well. But you can also do fusion or disc replacement for disc herniations, fusion if you have a scoliosis or a spondylolisthesis, which is where the spine is out of alignment. Spinal fusion surgery can range from a half hour to 8 to 10 hours, depending on what is being done. If you're doing a one level fusion or a one level disc replacement, that can typically be quite short, half an hour, hour and a half. Um, Occasionally, a spinal fusion is done for a lumbar scoliosis, and if that is the case, it can last, as I said, 8 to 10 hours. And again, everything in between, it really depends on what you're exactly trying to address. Yeah, so that can range, although with the advent of more minimally invasive spinal fusions, which we do a lot of now, it has improved a great deal. So for the average spinal fusion, most patients are off pain medications within a week, maybe two. Um, Same with a disc replacement. For some of the larger operations, or if someone has a history of pain and a more complex history, they may be on pain medications for a month or two. But for the average patient, most are off the pain medications within a week or two. Yeah, so I like to think of the recovery as coming in different stages. So, stage one is immediately after the operation, we get you up and moving and walking, and one may walk as much as they wish to. Stage two is typically around the 2 week mark after the operation, 1 to 2 week mark after the operation, where you can start to drive. Most people after a spinal fusion are generally back to work in the office in about 3 to 4 weeks. Some who have a more manual labor type of job may be out for a couple of months before they can start doing heavy work.